You need several pages to write down what makes us different from a typical oral surgery office or an oral and maxillofacial surgery office. Not only from the size of the complex here, but the way you're greeted when you come into the front door.
Great. I brought my paperwork.
Excited?
I am.
Yeah.
I'm excited, a little nervous, but excited as well.
We have everything under one roof, which is very rare. It's a lot different, going from this office to a typical oral surgery office. So we've got 2 fully functioning operating rooms with the capability and the equipment to have anesthesia teams come in, and we can place patients under complete general anesthesia, which is a huge advantage from both a safety standpoint and just a patient comfort standpoint. I think would be probably just as equally important to the patients, maybe more important sometimes. Another advantage is we have a restorative team and a lab here. If I were the consumer or if I was the patient and I'm bouncing around from the surgeon's office to the restorative dentist office to even going to a lab to have the lab technician or the artist kind of look at you in their lab, and then you go back to the restorative office and have your teeth placed. If something's not correct with the teeth, or they don't fit, or they're not the color that you chose, or then it's really, well, that's the lab's fault. Or no, the surgeon didn't place the implants in the correct spot. Well, here, having the whole team here, the accountability is more with the team. And I think it benefits the patient in a huge way that they may not even realize if this is the only place they've ever been. But we hear it where patients have been to other places for consults and they come here for a second opinion, or they come here and they go somewhere else for a second opinion. We usually end up getting the patient back. They come here for their treatment because they see how convenient it is having me as the surgeon downstairs going through their consultation with them, then them going upstairs to the restorative department and having the lab also there where the lab technician just walks out of the lab, comes to look at you, face to face, so they're not just looking at a picture. They can come out and they're actually discussing the case, what would be the best color, the best size, the best shape of the teeth with the patient here in-house. Everything is custom for every patient. And when you're getting down to those levels of being able to customize it with that much detail, it's important to have not only the surgeon who's going to be placing the implants, and the dentist who's going to be making the teeth, and the lab who's going to be basically doing a lot of the art part to getting the final product, to have everybody where they're talking and working hand in hand all the time on every aspect of the case. It's a huge benefit for our patients.
If you would like to view more informational videos on New Teeth Now, please click the subscribe button here. Thanks for watching.